What is dementia? If you browse through the internet, you will see a lot of people talking about dementia. You see a lot of posts, a lot of comments about dementia. And on this podcast, Care Conversations with Chidi, I am going to be describing dementia to you today, at least from a definition point of view, and try to explain some features that you would find in a person that is demented that will help you differentiate it from other diseases that affect cognition and memory. Okay, so just for an introduction, dementia is not a single disease. It's not just one disease. It's an umbrella term that describes a group of progressive brain disorders that affect memory, affect thinking and reasoning, affect communication, affect behavior, and ability to perform daily activities. You see, we often focus on just the memory part, but dementia affects 5 levels of mentation: your memory, thinking and reasoning, communication, behavior, and ability to perform daily activities. Now, you see, dementia results from damage to brain cells, and this damage can occur following various types of pathologies, which will lead you to the various types of dementia. I'm going to handle that in another video, but the most important thing is that this damage to brain cells usually leads to interference with how the brain communicates internally. The brain is made up of multiple neural fibers, and this communicates through electrical impulses, and dementia interferes with this communication, which now leads to the manifestations of dementia that we see. Memory loss being the most prominent of them all. And so if you find someone with a diminishing cognition or reducing memory capacity, what are the characteristics that you might find in such a person that would help you say, oh, this is likely dementia? Remember, if you're not a physician trained for this, you should not be making the diagnosis. Okay, the best you can do is to identify something that looks like it and take it to a physician. But this podcast is just supposed to help create awareness to the general public and to my audience, which I believe includes caregivers, family members, and even people with early onset dementia. When you find these features, it could help you tell that, oh, what this person is going through is not just normal, that this might be the early symptoms or the late symptoms or whichever level the person is of dementia. Now, firstly, dementia is progressive. So the symptoms that the person is manifesting with will be getting worse as the days go on, from time to time, So this year, the person will be worse than last year. This month, it might be worse than last 3 months or something, So there is a progression, okay? And also, you need to know that in most cases of dementia, it is irreversible. And that means that symptoms can only be supported, but we cannot reverse the damage that has happened and to this person. And also, dementia affects each person differently. The symptoms of dementia you find in someone might not completely mirror what you find in someone else. And so it's important because people tend to correlate their symptoms with other people. And if they know someone who has had a diagnosis of dementia, so they try to map the attitude, the behaviors, the characteristics they found in that person to some other person that they know that is manifesting symptoms of dementia or what they think are symptoms of dementia. And so it's important to know that each person's manifestation is different. And so you could misjudge a person who is clearly having dementia just because he's not manifesting the way you thought or the way you've seen some other person who had dementia manifest. Okay? And also remember that dementia is not a normal part of aging. Okay, it's still a disease, even though it's pretty common. And while aging might slow memory slightly, dementia causes significant decline that interferes with daily life. And that's one key feature. You see, the interference with normal daily life is one thing that will lead you to know that this is likely a pathology and this is pathological memory loss and not just a normal decline as a result of age. I hope this has thrown some light on this topic, and I'll see you in the next episode. Do well to like and subscribe and follow me if you like contents like this. I'm the executive director of Vimsa Home Care Services, and we are specialized in caring for patients with dementia. Our services are non-clinical, they are purely care-based, and we train our staff to do this and to focus on the core meat of the matter, which is helping sustain, helping improve the quality of life and the dignity of persons living with dementia. See you in the next episode. Bye-bye.